Good afternoon, everyone. My name is Cynthia Lopez Paz, and I'm with the LA Found program. Happy Autism Awareness Day month, actually, and I'll be your moderator for today. I lead the LA Found program for LA County Aging and Disabilities Department. I want to thank you all for joining us today on today's webinar, Autism, Elopement, and Transit Safety. Resources for caregivers and families. Now, it is my pleasure to introduce our Aging and Disabilities Department Director, Moral Karakusian. Ms. Karakusian is a dedicated public servant with over 20 years of experience in human services, practice, policy development, and community advocacy. Her career is marked by a commitment to advancing equity and improving outcomes for Los Angeles' most vulnerable populations, including older adults, people with disabilities, foster youth, and survivors of systemic injustice. Most recently, she served as the Senior Children and Human Services Policy Deputy for Supervisor Janice Hahn, leading legislative and policy initiatives across child welfare, aging, disability, food systems, social services, as well as other critical areas. She was instrumental in supporting the LA Found program in her tenure with the supervisor, and now she is our director. Please welcome Moral Karakusian.
Thank you, Cynthia. I really appreciate that. It never gets easier having your bio read before you provide opening remarks. So I'm just going to be really quick. Thank you for joining us today for Autism Acceptance Month. At the Los Angeles County Aging and Disabilities Department, our mission is to support older adults, people with disabilities, and neurodiverse residents so they can live safely and independently in their current communities. Safety, dignity, and independence guide our work every single day. Autism touches more families than many people realize. According to 2025, from the data from the Centers for Disease Control and Prevention, about 1 in 31 children in the United States have been identified with autism spectrum disorder, or ASD. ASD is over 3 times more common among boys than among girls. And as awareness grows publicly, our public systems must evolve to better support safety and inclusion. We know that individuals with autism and other neurodevelopmental conditions face a higher risk of wandering, and this is why LA Found is so important. And so for many families, this is a constant concern. This is why Los Angeles County created LA Found, a countywide safety initiative focused on prevention. The program provides wearable, trackable technology paired with coordinated response strategies from law enforcement and social services so individuals can be located quickly and safely. We also recognize the vital role that caregivers play. They advocate, plan, and work tirelessly to keep their loved ones safe. Our responsibility is to make sure they have the tools, information, and partnerships that support them. Through collaboration with LA Metro, Easter Seals, and community organizations, we're working to strengthen safety and mobility for neurodiverse residents across the county. Together, we can continue building a Los Angeles County where every resident has the support and tools they need to thrive. I really appreciate having the opportunity to provide these remarks. Thank you very much. Have a really good webinar. And thank you to the team. So I will hand it off back to you, Cynthia.
Yes.
Thank you. I appreciate it, everyone.
Thank
Take
you so
care.
much, Ms.
Thank you.
Karakusian. Now, it is my pleasure to introduce the supervisor for the 2nd District, Holly J. Mitchell, with some remarks.
Hi, I'm Holly Mitchell, your Los Angeles County Supervisor representing the 2nd District. And thank you for joining me and the LA County Department of Aging and Disabilities in recognizing Autism Awareness Month. I believe that an equitable and inclusive LA County means public systems that work for everyone. And that certainly includes our neurodiverse residents and their families, who deserve resources and support that reduce risk before a crisis occurs. County programs like LA Found demonstrate what is possible when support is paired with innovation and compassion. By using technology and coordinated response systems, we're helping ensure that vulnerable individuals can be located quickly while giving families some peace of mind. Inclusion also means ensuring all community members can safely access reliable transportation. As an LA County Supervisor, I have the honor of also serving on the board of directors for Metro, where I get to help improve our transit system throughout LA County. That requires considering the unique needs of our neurodiverse transit riders. Last year, the Metro Board approved a policy I brought forward to create solutions for improving transit access directly informed by neurodiverse residents and their families. And so I look forward to sharing more updates on this and the ongoing work we've got to do to ensure that residents with autism, residents who are neurodiverse, and all residents who need a little extra support are met with the respect, dignity, and support they deserve. Awareness is just the baseline. We've got to take ongoing action that can't be done without you. When agencies, community partners, and residents work together, we can create more accessible, welcoming, and inclusive communities across the county. Thanks a lot.
Thank you, Supervisor Mitchell, for your leadership in these efforts. Now it is my pleasure to welcome Los Angeles County Commission on Disabilities President Carlos Benavides. President Benavides was appointed to the commission by Supervisor Kanabi on June 15, 2014, and subsequently by Supervisor Janice Hahn of the 4th District. In addition to his role as the president of the Los Angeles County Commission on Disabilities, he is also the chair of the Patient Advisory Council at Rancho Los Amigos National Rehabilitation Center. He's an incredible partner and ally to the Aging and Disabilities Department. We are so grateful for your leadership and that of the Commission. Now it is my pleasure to welcome President Benavides.
Hi, it's a sincere privilege to be here, and I truly appreciate the very warm welcome. My name is Carlos Benavides. I am president of the Los Angeles County Commission on Disabilities during a particularly significant time. This month, we're focused on advancing safety and mobility for neurodiverse individuals during World Autism Awareness Month. We believe that this work is essential because informed caregivers save lives. We're navigating an era where technology and accessibility are more deeply intertwined than ever. And today's episode, Autism, Elopement, and Transit Safety, Resources for Caregivers and Families, gets to the heart of that mission. Programs like LA Found are so critical because they address a fundamental human need, safety and peace of mind. When we talk about providing trackable bracelets and smartwatches for residents with Alzheimer's, dementia, or autism, we aren't just talking about gadgets. We're talking about a safety net for our most vulnerable neighbors and their caregivers. We're eager to discuss how we can bridge the gap between high-tech innovation and the everyday realities of the disability community. Since we're discussing the intersection of safety and technology today, what do you feel is the biggest hurdle currently facing LA County families when it comes to adopting these types of life-saving tools? Hope everybody enjoys the webinar, and thank you for having me. I appreciate it.
Thank you, President Benavides, for those remarks. Now, please help me welcome Supervisor Lindsay P. Horvath from the 3rd District.
Good afternoon, and thank you for being part of this conversation. Autism Acceptance Month reminds us that public systems must continue evolving to meet the real needs of real families. For neurodiverse community members, safety is often tied to predictability, understanding, and responsive services. That means our emergency response systems, our transportation networks, and community programs must work together. Programs like LA Found show how innovation can strengthen public safety. By integrating wearable technology with coordinated response protocols, Los Angeles County is improving its ability to respond quickly when someone goes missing. At the same time, we must continue improving coordination across departments and ensuring families experience a system that is clear and accessible. Transportation also plays a key role in independence. Transit systems that incorporate neurodiversity-informed training and design can help individuals navigate their communities with greater confidence. Our goal is simple: public services that are easier to access, more responsive, and better connected. Thank you very much.
Thank you, Supervisor Horvath, for those remarks. Now it is my privilege to introduce our next two presenters, Dr. Ashley Wiley Johnson and Althea Vovell, who will be sharing valuable information on the Neurodiverse Metro Rider in Transit program. Dr. Ashley Wiley Johnson is the Vice President of Los Angeles Speech and Language Therapy Center, a family-owned organization with over 40 years of experience supporting individuals with autism and other special needs across their lifespan. As a second-generation speech and language pathologist, she leads a multidisciplinary team providing services ranging from early intervention and social skill programs to employment readiness across multiple sites in Los Angeles County. Dr. Johnson is deeply committed to improving equity in special education with a focus on reducing disparities in services for African American and Latino students. She has developed innovative service models, built partnerships between schools and private providers, and integrated speech therapy into classroom settings to better support student development. As a nationally recognized speaker and author, Dr. Johnson continues to lead conversations on inclusive, effective approaches to supporting individuals with autism and their families. Althea Vovell Esquire is the Deputy Chief and Civil Rights Program Officer at LA Metro, where she serves as a member of the senior leadership team. In this role, she oversees key areas including EEO and compliance, accessibility and Title VI, the Office of Equity and Race, and Diversity Inclusion, helping to advance equity and accountability across the agency. With more than 20 years of experience in labor and employment law, Ms. Vovell has built a strong career as an advisor, litigator, and investigator. Prior to joining Metro, she worked at Twitter, where she guided leadership on complex workplace investigations and employment law matters. Ms. Vovell holds a Juris Doctor from the University of San Francisco School of Law and a bachelor's degree in communication studies from UCLA. She brings a deep commitment to civil rights, equity, and inclusive workplace practices. Now it is my pleasure to introduce both of these outstanding ladies.
Good morning and thank you.
Morning.
Again, my name is Althea Vovell. I'm the Deputy Chief of the Office of Civil Rights here at LA Metro. Thank you for this opportunity to share more about Metro's commitment and vision, especially during Autism Awareness Month. Simply put, Metro is committed to providing a safe, clean, reliable, and welcoming transit system for all riders, one that is inclusive and accessible for everyone. This commitment is reflected by our CEO, Stephanie Wiggins, and flows throughout our executive team to our public-facing employees. We strive daily to exceed the baseline for accessibility required under the law, reflecting Metro's commitment to serving the diverse needs of LA County. Our work continues as we seek ways to advance accessibility across the system and go beyond the work we've done to support those with physical disabilities. With that is a growing recognition that riders with non-apparent disabilities, including those who are neurodiverse, may experience barriers that are less visible but still significant when using the Metro system. These barriers can include sensitivity to noise, smells, and crowding, challenges navigating complex or unclear information, and difficulty adapting to unexpected service disruptions, such as delays, reroutes, or mechanical issues. As Director Mitchell stated, Metro initiated this effort in response to a board motion. The result was a comprehensive effort to gather feedback from neurodivergent individuals, including those with autism, as well as their caregivers, on their experiences using public transit and opportunities for improvement. We worked in partnership with community-based organizations to ensure this initiative was informed by lived experience of the neurodiverse and autistic community, and to gather feedback from those most directly affected. As an overview, and Dr. Wiley Johnson will go over this in more detail, we conducted a system-wide survey, mystery rides, listening sessions, and peer agency research to gather input on barriers to using public transit and potential opportunities for improvement. But ultimately, we intend the findings from this initiative will help inform our future services and enhance rider experiences. As we've heard, autism impacts 1 in 31 8-year-old children who experience the world differently. Additionally, autistic adults have the lowest unemployment rate of those with disabilities. All this further supports the need to develop solutions and remove barriers to building independence among this community, which includes improving our services and targeting specific strategies to address the needs of neurodiverse riders and their caregivers. Through our efforts, we intend to promote broader inclusion as we continue working with our community-based partners to create long-standing improvements, whether it be structural changes to trainings, like transit and safety practice, or travel training sessions, improved technology, or other improvements to support our riders during the upcoming large world events like the FIFA World Cup and the 2028 Olympic and Paralympic Games. But importantly, these improved and enhanced services are to create lasting legacy improvements to enhance our riders' day-to-day transit and to promote impactful service and workforce improvements. Thank you.
Thank you, Althea. Hi, everyone. Happy Autism Acceptance and Awareness Month. As we mentioned, thank you so much to the LA County Office of Aging and Disability. It's always an honor to spend time to address LA County residents and talk about the work that we're doing at the Wiley Center. My name is Dr. Ashley Wiley Johnson, and I am the principal investigator at the Wiley Center for Speech and Language Development. And that is in connection with the Los Angeles Speech and Language Therapy Center, which was founded by my mother in 1979, none other than Dr. Pamela Wiley, who has been a source and a force here in LA County and what we do and how we support individuals that are neurodiverse, specifically with autism across the lifespan, because we have been doing it now for 47 years. The individuals that we do it with every day, many of whom have been with us for 24 or 43 of the 47 years, are individuals that care deeply about the lives of people with autism, whether we are parents of children who have kids who have children who have autism, or whether we just care about the families that we serve. Thinking about our lives and the lives of the individuals that we serve is always at the center of the treatment that we've been doing now over the course of the past 47 years. At the Wiley Center, we understand for each of our families the importance of creating a pathway to independence for all of our children, for their families. And for us, that pathway includes the community. In transit, that independence can look like a parent feeling comfortable getting on the bus with their child, knowing that they can safely get from point A to point B, which many times, as often point B is a therapy center or a place like the organization that we have. As we get older, that transit and pathway to independence looks like allowing a neurodiverse individual to feel comfortable and get into the adventure of riding transit to their college or to their workplace. The goal for us is to ensure that the commitment and confirm that transit is something that's safe and something that we know is intimately embedded. At the same time, we've seen firsthand the love of transit, whether it is a young child with autism who has a love of trains or a love of buses or a love of wheels, or the fact that we're using them in our therapy as therapists who work with children that are neurodiverse. As that playtime with transportation turns into what we've seen many of our young adults who are transit lovers and have centered being even transit employees or lifelong riders themselves. Transit is something that's really important to the neurodiverse community, and parents who are often involved as caregivers throughout the course of an individual with special needs lifespan knowing that they can rely on transit is important to them. And if it's important to them, it's important to us here at the Wiley Center. So this month, as we celebrate Autism Awareness Month, we are really grateful that we have truly spread our wings and focused on empowering neurodiverse individuals outside of the therapy room and working to improve the world that they interact with on a day-to-day basis. Who better to do this than with LA Metro, which is one of the largest transit systems in the world. And after working so closely with them, we could say they're one of the best as well. Our project was designed similar to how we design our therapy, with people that are neurodiverse in mind, informed by them, informed by their caregivers, so that we can support and give this information over to Metro. The work was rewarding, the response was overwhelming, and it's truly shaped the fact that this project has ended up being a remarkable and valuable contribution to Metro and to the body of research that provides data informed information about the needs of individuals that are neurodiverse. This is just the beginning. We're kicking it off here with Autism Awareness Month, and we'd like to share a video with each of you all that just talks about the work that we've done.
I really like trains and I really like Metro.
To date, autism impacts 1 in 31 8-year-old children in the United States.
Service is good and I enjoy riding when I go to work, but I became frightened by one incident I experienced. I recall being punched at the back of my neck, but I didn't look at the perpetrator directly. This is just a serious wake-up call to be aware of your surroundings everywhere you go. I shared my experience with Dr. Wiley and the Wiley Center.
People who are neurodivergent experience the world in different ways. For many families, everyday activities like taking public transit can bring unique challenges. That's why it's important to create transit experiences that are safe, predictable, and comfortable, while also supporting each rider's independence and confidence.
Our ultimate objective is in line with what Metro does every day, though, and that's to identify challenges and the unmet needs of our riders, and especially our neurodiverse and disabled riders.
Every day, Metro serves thousands of riders across Los Angeles County. For many people, public transit is the main connection to school, work, healthcare, and opportunity.
As Metro answered the call, we at the Wiley Center for Speech and Language Development are grateful to be the expert that Metro chose to partner with to bring this project to life.
Hello, I'm Dr. Pamela Wiley, founder and president of the Wiley Center for Speech and Language Development. For several decades, we've worked with children who are now young adults diagnosed with autism spectrum disorder and other special needs. We're now focused on their independence and honored to team up with Metro for the Neurodiversity in Transit study.
Hi, I'm Dr. Ashley Wiley Johnson,
principal at the Wiley Center for Speech and Language Development. Together, we at the Wiley Center partnered with Metro, WSP, and a vigorous public opinion firm to create Metro Neurodiverse Rider in Transit program, the first of its kind media-based mixed research design study to better understand the needs of neurodiverse riders and the caregivers who support them. The goal was simple: listen, learn, improve, with the understanding that improving Metro with neurodiverse people in mind will improve the ride for all riders. We implemented a 3-pronged approach. First, working with organizations throughout the county, Metro hosted 5 in-person listening sessions. Current riders and future riders shared their experiences, their concerns, and their ideas for what their ideal transit ride could look like.
Your voices are critical to the success of this project.
Secondly, 29 mystery riders took to the streets and rode Metro buses and trains in secret and documented their experiences in personal diaries.
My name is Dr. Shikari, and I'm working with Dr. Ashley as well as LA Metro to make sure that we have a great survey.
Lastly, in early 2026, neurodiverse people and caregivers across Los Angeles County responded to the online survey. Promoted through social media and community partners, the response was overwhelming and showed just how important the issue is to neurodiverse people and their families. With the help of Aviderus, we created the questions and had them readily available on people's phones. This overwhelming response truly complements why we did this digital campaign, since so many people with autism who use transit are using devices. This one response really shows us why we may have gotten so many participants.
I shared some of my opinions.
I am proud to support work that makes public transit more accessible, thoughtful, and welcoming for neurodivergent riders. I am grateful to our partners, our participants, and everyone helping move this work forward.
We kept the momentum going, got it done, and the results have come in. Neurodiverse people love Metro. It represents independence and adventure.
We ride every day on the Metro.
But there are still needs that truly bother this community and can be addressed.
Safety number one. More security.
I had to get off the bus. It was a very strong smell that I couldn't handle.
Trainings to learn how to deal with people who are neurodivergent. Going in with her, showing her step by step.
An app would be really good. Put all the information in one place.
We showed up, we listened, and what we heard is helping to guide meaningful solutions. And looking to the future, in 2028, Los Angeles will welcome the world as host of the Olympic and Paralympic Games. And our riders couldn't be more excited.
I would love to get out to some of those events like basketball.
Soccer, for sure.
I would like to go to track and field. Swimming and gymnastics. #Go Metro.
Metro is already working to make lasting improvements across the transit system as a part of this legacy. By putting the needs and lessons from this study into action, Metro is excited to have an opportunity to create change that supports neurodiverse riders and improves transit for everyone.
As our children are maturing into adulthood, we've begun to focus on life after high school, employment, and ultimate independence. We continue to walk alongside them every step of the way. We are looking forward to riding the new and improved Metro.
Go Metro! Metro Neurodiverse Rider and Transit Program.
Thank you. That is an awesome video. Thank you, Ashley and team. Thank you. And LA Found for this opportunity to share that information with you all. Thank you to our neurodiverse community who participated. We've heard you. We are making changes for you. And we believe these changes will improve services for all of our riders. I also wanted to thank on behalf of Metro our community-based organizations that partnered with us, and you'll see them listed here. We extend our sincere gratitude to each of the CBOs and nonprofit organizations who contributed their time, their expertise, and their lived experiences to support this important initiative. Your partnership strengthens our ability to deliver a more inclusive and accessible transit system. And we're grateful for your continued collaboration in advancing equity in public transportation. We look forward to sharing out our service improvements and enhancements based on the Neurodiverse Rider and Transit Program in the upcoming months. So stay tuned. Thank you.
Thank you, Dr. Johnson and Ms. Bovell, for presenting on this very innovative program. We're really excited, especially here with LA Found in the Aging and Disabilities Department, to hear about the Neurodiverse Metro Rider in Transit program, and also the meaningful ways that it will support the unique needs of neurodiverse individuals navigating the transit systems, and for them to be able to be independent and use them independently. Now it is my pleasure to introduce Miliana Millie Minjares. She's from Easter Seals, and she will be presenting on the START Crisis Program. Ms. Mijares is the Associate Program Director with Easter Seals of Southern California. With over 10 years of experience, she has supported the underserved individuals with developmental disabilities, mental health needs, and other complex challenges across multiple systems of care. Her work focuses on crisis response, stabilization, and building long-term capacity through person-centered approaches tailored to everyone's strength and support systems. Ms. Mijares is deeply committed to collaboration, working closely with families, providers, and community partners to improve outcomes and strengthen services. She is especially passionate about trauma-informed care, mental health awareness, and expanding access to critical resources, and remains dedicated to creating meaningful, lasting impact for individuals and the communities she serves. Please help me welcome Ms. Mijares.
Hello, everyone. I am so excited to be here. Thank you all for having me. As we mentioned, I will be going over our START Crisis Program and a few of our Easter Seals departments as well. So here within Easter Seals, we have 5 service lines: autism therapy services, adult day services, child development services, living options, and work first/veteran services. Our START program falls under autism services. We have a unique ability to tap into our other service lines to collaborate and learn from other professionals in the field and create new linkages to meet individualized treatment needs. So in our START Crisis program, we currently have about 60% of our children in our program are diagnosed with autism spectrum disorder, and about 53% of our adults are diagnosed with autism spectrum disorder. For START, you might hear of different START programs: Early START, START for School Threat Assessment Team, and for us, our START stands for Systemic Therapeutic Assessment, Resources, and Treatment. We are an evidence-informed community prevention and intervention service model, and we serve individuals as early as 6 years old, all through lifetime. So I believe our oldest participant in our program is around 74 to 75. And so it is really great for us to work in a person-centered and solutions-focused way so that we can support the capacity of the providers, the caregivers, the people out in the community who are supporting this specific population. For our team, we have recently launched in 2022, so I would still consider us in the early ages. We are a certified START program with our National Center of START Services, and this is just a brief overview of who is currently on our team for the East Los Angeles Crisis Program, and they all come from a wide range of backgrounds. So we're able to get a lot of different views from everybody when we're serving our different participants and their families, and bring a new perspective in when we're also meeting with community partners as well. So we lean on each other to share our expertise and ensure that all gaps that are identified are addressed, and that we can find the right person to support the people in our program. For our START program, we currently work very closely with the Eastern Los Angeles Regional Center. This is our primary source of referrals, and this is who we work with on ensuring that we are linking with the appropriate community partners to also keep our participants and their families informed of the services that are available through the regional center, but also through the community. The Eastern Los Angeles Regional Center has just been very instrumental in our program development, and their philosophy is very much in alignment with Easter Seals' vision and plan and the START model seen by their mission statement to help individuals with developmental disabilities achieve meaningful and fulfilling lifestyle in the community. We also do have a START team that's currently being established with the Orange County, the Regional Center of Orange County as we speak, and we're very much looking forward to serving this area as well. A little bit about our START philosophy is we are very grounded in positive psychology, and we follow a biopsychosocial model with a focus on overall wellness. Our Case management follows a strength-based approach. So we're constantly looking at what are the strengths of the person in our program, their caregivers, their staff, their service coordinator, their community resources, and their day program. And our STAR coordinators, who are the ones going out in the field and supporting our individuals, they are the ones who are helping individuals with IDD, with autism, and their systems to identify individuals' PERMA, and with identifying these methods and strategies to access PERMA. PERMA stands for positive emotions, engagement, relationships, meaning, accomplishment, and the plus stands for vitality. So that wellness piece, whether that be diet, exercise, sleep, any health-related topics that need to be included in overall wellness, we'll want to include that as well. So we are constantly assessing when somebody is first referred to our program, and when they're in the middle of our program, and then when they're reaching stability. We're constantly assessing to ensure that the people in our program have access to PERMA Plus, and that they're able to live a life that they desire with the goals that not only that their family has for them, but the goals that they have for themselves as well. For the biopsychosocial model, we can see here how they do not act separately. We are constantly looking at how each factor is playing into each other. How does the biological impact our participants' psychological well-being and their social well-being? Is their psychological well-being impacting their ability to take care of their biological health? Is it impacting their ability to access social opportunities? And we tried to see what is missing from each of these different categories and understand how we can address these different areas so that we can support our participant in reaching that overall mental wellness. This is a quick overview of what it looks like to go through our program. So in the referral, once we receive that, it's a very quick turnaround. We understand that the people being referred to our program are in crisis, and that crisis can range from not going to school, not eating, to very severe crisis of law enforcement encounters, leaving unexpectedly, elopement, or even frequent hospitalization. So we understand that we need to rush our services as soon as possible so that we can start providing that oxygen to the families that we're supporting as soon as possible. Through the intake phase, we'll learn more about the biopsychosocial. We'll conduct assessments to understand how the family's experiences are, how the person's experiences are, and what the relationships look like between the systems, so the paid supports and the natural supports who are supporting the person in our program. Treatment involves, again, multiple assessments, but we're going out and closing those gaps of communication between providers as well. So if we have multiple prescribing providers, whether that be a psychiatrist, primary care physician, a neurologist, whoever's prescribing medication, whoever's writing IEPs in the school setting, or their service coordinator, will want to make sure that everybody's has consistent communication and that we're able to address those gaps. We will then work on transition planning. And through that transition planning, we're constantly assessing for inactivation due to stability, which you could see here is graduation. And that's usually reached by the 14-month mark to 2-year mark, depending on the individual. So we always want to make sure we're checking in with the family and the paid supports to ensure that they also agree that stability has been met before we phase out services. And for Easter Seal supports, specifically for our participants who need support with navigating transit and other modes of transportation, we assess the ability to learn these skills, link them to resources using our knowledge of community resources and our community linkages that we make with our community partners. We also support our participants and their caregivers by creating a cross-systems crisis prevention and intervention plan. It's a very long name, but basically this is a full plan with medical considerations, psychiatric considerations, expressive and receptive communication considerations, their background with law enforcement, with transportation. And then at the end of that crisis plan is where we'll have how to identify what it looks like for an individual to be out in the community attempting to navigate different transportation sources and how we can implement interventions to support the safety of the individual. And we do have our 24/7 crisis line that we can also support coaching through this crisis plan. And this is not created by our team specifically. We are the writers of this plan, but we engage all system members in sharing their background with the participant, what's working, what's not working, so that we can create a collaborative crisis plan. We also include safety risk related to leaving unexpectedly or navigating transit. And we also enjoy utilizing our coaching team to teach the participants and their caregivers skills to ensure that they can stay safe during drives to their destination so that the crisis doesn't take place in the car, the bus, or the train. And Easter Seals as a whole continues to work towards training for transportation providers and other community partners to ensure that we are spreading awareness and to support more inclusive services throughout Southern California. And this is our contact information. So if you have any questions, you could always reach out to myself, and we do have a customer service line. And I would also encourage everybody to reach out to or to just look up our Easter Seals campaign for Autism Awareness and Acceptance Month. And it is our Everyone with Autism Belongs campaign. It's a very cool campaign. So thank you, everybody, for your time.
Thank you, Millie, for such an informative presentation. And again, I just wanted to tell you that we truly appreciate you sharing this valuable resource and also the important work that you're doing with Easter Seals to support neurodivergent individuals and their families. Now, I would like to share some special remarks with everybody. Please help me welcome the 5th District Supervisor, Catherine Barger.
Hi, I'm Supervisor Catherine Barger. As we recognize Autism Acceptance Month, we are reminded of responsibility at the core of local government, protecting our most vulnerable residents and supporting the families who care for them. For many families, raising neurodiverse loved ones, prioritizing their safety is a part of everyday life. Planning ahead, knowing where to turn for help, and trusting that public systems are ready to respond make an enormous difference. That is why preparedness matters. Families shouldn't have to navigate complex safety challenges on their own. Strong public systems anticipate needs, coordinate resources, and ensure that help is mobilized quickly. This work depends on partnerships. Families, caregivers, community organizers, and public agencies all play a role in building communities where individuals with autism live safely and with dignity. Autism Acceptance Month is not only about awareness, it's about strengthening the systems that support people in tangible ways. I want to thank the families, caregivers, advocates, and public servants who are invested in this work every day. Your commitment makes Los Angeles County stronger, more responsive, and better prepared to protect those who rely on us most. Thank you for being part of today's conversation and for the care, compassion, and support you offer every day.
Thank you, Supervisor Barger, for those remarks and for your support of our neurodiverse populations. Now it is my pleasure to introduce Nitza Becerra, who will provide a brief presentation on the LA Found program and how caregivers receive a free tracking bracelet for their loved ones. Ms. Becerra has been with LA County for over 19 years, 17 of which were served at the Department of Public Social Services. She joined LA Found in 2025 and is a very dedicated individual to our most vulnerable populations. So please help me welcome Ms. Becerra.
Thank you, Cynthia. Today I'll be providing information for the LA Found program and the importance of safety tools for our most vulnerable populations. But first, let me start by sharing the story behind how LA Found was started. Nancy Pelucas, a 55-year-old Manhattan Beach resident, engineer, and businesswoman, was living with early onset dementia. On October 15, 2016, during an outing with her husband, Kirk, she wandered away from the Los Angeles County Museum of Art, prompting a countywide search. Without a tracking device, her husband, law enforcement, and friends searched tirelessly. Despite the search, her remains were found 2 years later. Her story became a catalyst for change, leading to the creation of LA Found, which works to improve coordination, awareness, and recovery efforts for missing individuals across Los Angeles County. In February 2018, the Los Angeles County Board of Supervisors unanimously approved the Bringing Our Loved Ones Home initiative, now known as LA Found, a groundbreaking countywide effort to help locate individuals with Alzheimer's disease, dementia, and autism, and other cognitive impairments who may be at risk of wandering. The initiative was championed by Supervisor Janice Hahn, whose involvement in the search for Nancy Pelucas brought urgency and heightened awareness to the need for a coordinated response. Led by the 4th Supervisor District in partnership with the Department of Aging and Disabilities, the expert-informed LA Found Task Force supports some of our most vulnerable community members by providing education, safety strategies to help prevent wandering and free locating technology for families in need. If you would like more background information for the LA Task Force and the LA Found Initiative or BOLO report, you can scan the QR code for more information on that. In its 7th year, LA Found honored Nancy Pelucas on October 15, 2025, which was proclaimed as LA Found Day by the LA County Board of Supervisors. This day serves as a reminder to protect our loved ones who have Alzheimer's, dementia, or autism, and other cognitive impairments, who wander, and to keep them safe. LA Found is a program that serves vulnerable families countywide. According to the Centers for Disease Control and Prevention, about 1 in 19, or 5.3% of 8-year-old children were identified with autism spectrum disorder in California. About 1 in 6 children of age 3 to 17 were diagnosed with a developmental disability. Autism is reported to occur in all racial, ethnic, and socioeconomic groups. An estimated 49% of children with autism will engage in wandering behavior. Finding people quickly is the key to ensuring their safe return. So let's talk about the LA Found program and how we're here to help. LA Found partners with 2 types of technology. The first one is a radio transmitter device from Project Lifesaver International, which is a community-based nonprofit organization that helps protect and quickly locate individuals with cognitive disorders who are prone to wandering. Participants wear this waterproof device, normally on their wrist or somewhere on their body, where it is meant to stay on the body every day and does not need to be removed. There are guidelines to follow and important emergency protocols, specifically when wearing this bracelet to keep loved ones safe in case they wander. For younger children and those with sensory issues, this device can be worn on the shoe, in a pocket, or LA Found team members can also help you explore other options. The second device is the GPS Viora Care smartwatch by Clairvoyant Networks. This technology offers an alternative to the Project Lifesaver and is specifically designed to work with an app on the caregiver's phone for tracking. This device is also worn on the wrist as a watch and has a locking mechanism. There's also an SOS feature and multiple caregiver setups. So how do we know if you qualify? The eligibility criteria is simple and accessible, as there is no income requirement. There's no need to have Medi-Cal or Medicare. To enroll, a person must have a cognitive impairment, such as Alzheimer's, dementia, autism, developmental disabilities, or a traumatic brain injury. They must be mobile and prone to wandering and be an LA County resident. And to apply, there are 3 options. We have a QR code that can be scanned. You can apply online at la.ad.lacounty.gov. We have an email, la@ad.lacounty.gov, where you can request an application, and one can be either mailed or emailed to you, or you can call 1-833-569-7651 to request an application to be mailed or emailed. So we train caregivers with what to do when a participant goes missing. The Project Lifesaver bracelet requires the Los Angeles County Sheriff's MET team to go out and track the bracelet with a specialized antenna. Family caregivers are trained to call 911 immediately within at least 15 minutes and use keywords to identify their loved ones as at risk. Providers, they need to provide the device's frequency number and the special LA Sheriff's Department MET phone number to aid first responders. The 911 operator may then route the call to the nearest law enforcement jurisdiction and request assistance from the LA Sheriff's Department's MET team if needed. Caregivers are recommended to contact the LA Found hotline for additional support. LA Found will follow up with both the family and the Sheriff's MET team to make sure the search is underway. In addition, clients receive free spare parts, ongoing supports for their loved one, resources for law enforcement, schools, care centers, and caregivers. The LA Found team is available to discuss any program requirements, go over caregiving responsibilities, and bracelet assembly, and also to provide county coordination, works with contacting 911. LA Found also conducts educational webinars, which can be viewed through our Aging and Disabilities YouTube channel as well. We attend many community outreach events throughout LA County and conduct presentations for providers and agencies. And with that, we conclude the LA Found program presentation. Thank you so much for your attention.
Thank you so much, Ms. Becerra, for that very informative presentation. Now we have a couple of minutes for some Q&A. So if you haven't done so already, please use the question and answer function at the bottom of your menu for the Zoom webinar. And any questions for our panelists, please, you can go ahead and either type them up or you can unmute yourself and go ahead and ask them. But I will check Maritza. Is there anybody that has any questions thus far?
We do have one question. The question is the START program available at all regional centers? And if it's not, are there any talks of expanding the type of program to other regional centers?
Yes, it is available to different regional centers, and I can drop the link to the DDS website where it has a list of all the regional centers that the START program is. But there are new programs who are exploring with regional centers that don't currently have them to determine if we can get a START program in those regional centers as well. So if we're not currently in your regional center, or if you just have questions about that customer service line with Easter seals that was dropped in the chat, you can feel free to call that line and we can always support you with identifying if you have a START program at your regional center, even if you're not in the East Los Angeles regional area. Our customer service line can also support you with locating that information as well.
Awesome. Thank you so much for that. We do have another question. Will transit staff be trained in dealing with a neurodivergent individual in crisis?
Yes is the answer to that. We currently have training for specific individuals and disabled individuals that includes a portion on neurodivergence. However, one of our plans is to expand that training and use perhaps one of our community-based organizations that specialize in neurodiversity and autism to help us expand that training and to do in-person and video training.
Yes, of course. Thank you so much. There is one more question. What measures will Metro take to ensure that safety of neurodivergent individuals is ensured?
Well, we have over the past years increased our safety by increasing uniformed individuals on our system. That's another area, though, that we are intending to expand. We have officers on our system, we have ambassadors, and we can also get information through our customer service centers in our stations. As far as confirming or ensuring the safety, our safety numbers have improved over year. So that is a good sense of information and a good source of confidence for us in improving our safety measures. However, there's always room for more improvement, and so we intend to do that as well.
Thank you so much for that. And then our last question that I think we'll have 1 minute in time for is what states does Easter Seals have programs? Where do they do business? What are those states?
Yes, it's a good question. So Easter Seals has, they serve multiple states. If you are online and you're able to go to www.easterseals.com, there's a search bar that shows you all the states and you can find your local Easter Seals department there as well.
Well, I want to just take a moment right now to thank all of our speakers, Dr. Ashley Johnson, Althea Boval, and Miliana Minjares. I really want to just thank you for your advocacy. You're really making a difference in the lives of neurodiverse individuals, and we thank you for that. We also would like to offer our most sincere thanks to the entire Board of Supervisors, Supervisor Solis, Mitchell, Horvath, Hahn, and Barger. Special thanks to our Aging and Disabilities Director, Ms. Karakusian, and President Benavides for his remarks. I want to thank the entire LA Found team, including Maritza Gomez, Juan Gwen, and Nitza Becerra, our AD communications teams, and Cristina Michiraggio from the New Freedom Transportation Program. To learn more about the LA Found program, please scan the QR code on this slide. You can also reach out to us at 833-569-7651 or via email at lafound@ad.lacounty.gov. I want to thank you all for taking time out of your busy days to be with us this afternoon, and I wish you all a wonderful day. Thank you so much.